This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week on the program, my guest is Erin Black. She is a board-certified family nurse practitioner at KRMC's Mountain Shadow Family Medicine. Erin, welcome, or should I say welcome back?
Thank you for having me.
Thank you. You worked here at KRMC, and your career took you elsewhere. Now you've come back home. I'd love to start with some of the different chapters in your work life.
Yes, absolutely. I started at KRMC when I was in high school as a CNA. I then went away for nursing school. I got my associate's degree in nursing from Yavapai Regional Medical Center. I worked in the emergency department for about 3 years, and then I was a flight nurse. After that, I came back to KRMC to work in the cardiac cath lab. Took a short stint in an administrative position and then returned again to KRMC to work in the ICU. After I got my nurse practitioner license, I did go to North Country Healthcare. I've been there for about 2.5 years, and now I'm returning here to work in family practice as a nurse practitioner again.
So welcome back.
Thank you.
You know a bit about KRMC. You've spent plenty of time here.
I do.
What brought you back?
Just the home feeling. It feels like home base. I know a lot of the providers here. Patients are comfortable in this setting where it's easy for all of their medical records to be in one place. So it makes it really nice for my patients, and it just feels like coming back home.
You worked in the ICU, and if I'm not mistaken, you started in
2020, yeah.
What a time to start in the ICU.
Right in the pandemic, yes.
How was that?
Rough.
I don't think either of us wants to dwell on that very long, but...
It was hard. When the patients got bad enough to end up in the ICU during COVID, many or most never made it out. Yeah. And in the beginning, when we really didn't know what to expect, and we were limiting so much visitor and family and that interaction time, that made it much harder. So as the precautions, kind of the more we learned and the precautions lightened up and we were letting family back in to say their goodbyes, that got a little easier, but still, many didn't make it.
Yeah. And we've heard so much about the attrition, the burnout, the people who just said, I can't. Speaking of medical professionals who said, I've had enough.
I probably wouldn't have made it out if I didn't have a light at the end of my tunnel, that being, the NP school. And I was going to NP school during my time in the ICU. So knowing that, I wasn't going to have to be bedside forever or much longer, I think was the only thing that kind of gave me the hope to keep pushing forward through the mess. Before
that, you had worked as a flight nurse.
Yep.
I want to talk a little bit about that, if that's okay.
Absolutely.
I'm called to adventures. I had an adventure. I flew with one of the flight teams here based in Kingman for a radio show, and it was a fascinating experience. How long did you do that work?
I did it for about 3 years. I worked for Tri-State Care Flight. I was based out of Fort Mojave, or Care Flight 6. It was one of the busiest bases in the company, so being right there on the river and I-40, lots of scene calls, but also our fair share of just interfacility transfers from some of these smaller hospitals, taking patients up to higher level of care in Las Vegas and Phoenix.
And when you say scene call, that is going out and landing
on the highway or next to the river and scooping up your patient and going. Yeah.
Was that a kind of a kid thing for you, where you craved adventure and action?
I definitely, yes, was a bit of and still am, thrill junkie. You can't beat that. Just gut feeling that you just, the moment you're circling the scene, finding your place to land, that adrenaline just gets pumping. And
I'm watching you describe it. I feel like you kind of miss it in ways, do you?
There are times that, I would love to go back, but I don't know if I have that energy anymore. And also having a family, it's nice to be home for dinner every night and not missing that.
Obviously, it's also really dangerous work.
Yes.
I was just thinking, in February, we had the DPS helicopter that crashed near Flagstaff. Do you think about those things, or do you not think about
for
those
sure
things? Like when you're going out for a shift?
No, that definitely is one of the decisions that led me to leaving flight nursing. Is I was a new mom. I had a young daughter at home. Our company had a crash in New Mexico. A sister company had a crash in Phoenix right around that same time. And it really gets you thinking, like, yes, it's, someone's got to do it. It's a dirty job. Someone's got to do it. But does it have to be me, knowing that I have, a daughter that relies on me now?
Yeah. The people who are called to do that work, are they kind of fatalistic? Like, if today's the day, then it's the day?
And that's how most of them are, yeah. And they also just have a passion for it and a knowledge base that is astounding.
It's tough when that gets in your blood.
Yes.
Did it feel, and that may be kind of personal, but when you walked away, did you feel like you had turned your back on those folks? Or?
Not so much. It was more of I had my time. I loved my time, and it was time to move on and let someone else take a
next chapter.
Yeah.
Well, speaking of that work as a flight nurse, and then also, I can only imagine how difficult the ICU work is. This also might be a personal question, but I'm wondering, how it seems like it has to be a professional tool to know how to turn that off and to know, like, okay, now I'm on duty, now I'm not. How is somebody just wired for that, or is that a thing you can learn?
Definitely. I think you got to be wired. I don't think it's cut out for everybody. The ability to be able to just leave home at home and work at work. It takes a special something. Also, having that support system, my family at home, my faith, and also your coworkers. You kind of talk about it and get it all out and discuss what coulda, shoulda, woulda been before you leave. So you have that discussion prior to leaving. You get out all your feels, and then, it just kind of shuts off, and you get home and you're back with your family and your civilian self, if you would.
When we were setting up, you said it's trauma bonding.
Definitely,
it's a term I had never heard before.
Yes, trauma bonding. I think a lot of us that work in those critical care areas and nursing will giggle at how close and how quickly some of those relationships can build because of the things that you go through together.
You worked in so many different capacities of nursing. Is that kind of the key to understanding what it's all about, to see it from all those different angles?
I don't know if I'd say a key, because I've met some really awesome nurses that, had one specialty throughout their entire career and just super knowledgeable. I think it's learning is the key. Always expanding your knowledge base. But for me, I don't have the greatest attention span, so learning and changing, it was fun to me to be able to go through. And I learn best by doing. So, reading it in a book wasn't good enough. I really wanted to put my hands on it and do it. And that's how I learn best.
Kinesthetic education,
yes, absolutely.
Right? Get up
and do it.
But this line of work really lends itself to that.
Yes,
because you're working with patients.
Yes, yeah.
We kind of passed over this, but as a kid, you started as a CNA.
Yep.
And I wonder, that's so far in the past now, and you've done so much else in nursing. But is there any way in which that work as a CNA informs the work you do today as a nurse practitioner? Absolutely.
And as a nurse, it definitely made me a better nurse to know, to start at the bottom, if you will, and work your way up and know that every level matters. And your day doesn't run as smoothly without every person helping along the way. But as a nurse practitioner, coming up from a CNA and then nurse, for 13 years and then into my nurse practitioner, it really has solidified the patient-centered care that I so believe in.
I want to ask you about patient-centered care. We hear terms like patient-centered care and holistic medicine, and there's a part of me that really wants to believe that that's a thing. And also I wonder, because we get marketing and branding. Tell me, Erin, that these are more than just platitudes. What is patient-centered care for you?
For me, it's meeting the patient where they are. So taking into account in my treatment plan and in my discussion with them, not only their physical health, but their mental health, their emotional health, their social and economic status, their spiritual health, a little bit of everything in order to build the best treatment plan for them that they are going to be able to carry out and sustain, because that's the importance in healthcare, is being able to build those lifestyles that are sustainable.
You mentioned during your time in the ICU, during COVID, you knew that you had a light at the end of the tunnel, and that was the NP school.
Yep.
What went into that decision? Was that something you were always planning, or how did you become an NP?
It was not. Like I said, I had been a nurse almost 10 years when I decided to go back to school, and I enrolled in a MSN in leadership and management, actually, and took a job as an administrator. And about 6 months in, I knew it wasn't for me.
Did you feel your soul
I did.
Away?
I missed the patients. Yeah. I missed the care aspect. And so that lasted, I instantly dropped out of that MSN program. And within 11 months, I was back at the bedside and enrolled in my FNP program.
Okay. Tell me about that training, what goes into it.
A lot. So the FNP program is considered a master's, so it's a master's of science in nursing.
And FNP is family nurse practitioner.
Family nurse practitioner, yeah. So the program itself was 3.5 years. It kind of builds on the foundation that you learn in nursing school, but all the classes are advanced. So advanced pathophysiology, which is how the body works, advanced pharmacology, how medications work with the body, advanced health assessment, how to better evaluate the body. And then once you do all of your classroom-based training, it was over 700 hours of in-person clinical training.
Wow. And were you based in Kingman while you were working on that?
I did. I did all my training at North Country Healthcare with my mentor there. I have known him for many years. He actually trained me as a baby nurse in the ER when I very first started. So he's been a mentor a long time. Shout out to Sean Louie.
Yeah, thank you, Sean. What was it like for you when you finally reached that finish line?
Relief. Yeah.
But then also you're just starting all over again, right?
Nerves. Yeah. You go from, being very experienced in your field into nursing and jump right back into that novice starter position, and it's terrifying.
Surprise.
Yes, yeah.
If you're just joining us, this is Focus on Your Health. I'm TG LaFredo, and this week on the program, I'm coming to you from Mountain Shadow Family Medicine. My guest is Erin Black. She is a board-certified family nurse practitioner here. Let's talk about the scope of your practice here. What do you do? Who do you see?
So I am a family nurse practitioner. I have training to see all ages, birth till end of life. Here at Mountain Shadow, we concentrate mostly on adult primary care.
I know that NPs have a full range of skills, but also most of them have some areas that are near and dear to their heart. Do you have any special areas of interest?
I definitely do. The three big ones for me are diabetes, high blood pressure, and high cholesterol. I really like these because they're the three big ones, the most common. If you talk to anybody, most of them have at least one, if not all three. So it's the pandemic. It's in the population, especially here. And I like treating them because they're very treatable, even to the point that they can be reversed. And I like being able to help my patients see and feel those results. And that is something that improves their overall health, having those three big disease processes well managed.
When you talk about diabetes, blood pressure, and high cholesterol, I can't help but think about your time as an ICU nurse. You must have seen the back end of, I'm not trying to beat up on anybody, right? But after people live a certain lifestyle for a long time, and then it catches up with them.
Yes.
Right? You must have seen that day in and day out.
And I think that's why I have such a like for him, is I've seen the other side. Coming from that critical care background, you see what can become if you don't take care of yourself. A lot of the things, in ICU, in the ER, especially in the cardiac cath lab, a lot of that can be prevented with dietary and lifestyle modifications and having those disease processes well managed.
When a patient first comes in and has uncontrolled diabetes or lots of other problems, maybe dietary problems, how does that conversation tend to go the first time around?
Again, I am, especially if it's undiagnosed. So if I meet you for the first time and we find that you have diabetes, unless we're seriously out of control, my hope is I'm going to see you back in 3 months and you have made some dietary and lifestyle modifications as we have discussed. And then if we're still not looking the way we want to look, we'll talk medications. But I do always like to give my patients the opportunity, if they want it, to make those changes before jumping straight on, the medication bandwagon.
Do people tend to welcome those conversations? It's so difficult because this is a separate interview altogether, right? But our relationship with food is so complicated.
Very much, yeah. It's hit and miss. I have some patients that are very honest that say, I don't think I'm going to be able to make those changes. Let's just start the meds. And that's totally fine. I'm willing to work with them as well. But most patients, it's eye-opening for them to realize that what they're eating and what they're doing is now affecting their health, and they can see it. I have proof now, not so much just, they put on a few pounds, it's negatively affecting their overall health.
Well, we talked about meeting patients where they are. So maybe sometimes it's like you have to open that door slowly.
And I don't know if I'd say open the door slowly. I may lay it all out for them, and then by their feedback, we can decide together through that collaborative plan what works best for them.
That's fair. I guess what I should have said was to take the progress that you can get, right?
Yes,
Knowing that it can be a struggle.
Correct.
Yeah.
Yeah,
I
and
think
it's
that's a better way
nothing
to
that
say
we're
it.
not going to follow up on next time either. So it's something that we are going to continue having that conversation, and you may hear me say the same things over and over again, but, we teach through repetition.
Well, I know teaching is important to you. Patient education is important to you. What makes for good preventive care? What do you want patients to know?
It starts with them, first off. They have to be willing. But screening is very important. So those annual wellness exams, their labs regularly. The earlier we catch these issues, the easier it is to change. The earlier we catch the bad habits that are leading to them, the easier it is to change. But overall health starts with them, and it starts with prevention and being kind to the body. What we eat matters, how we move and what we do matters, and it all makes a difference to our overall health.
Yeah. The themes of the last couple of questions being dietary, lifestyle modifications, good decisions. I feel like in so many ways, this is not a groundbreaking thought, but in so many ways, our current food supply is set up for us to fail.
It is. It's easy to drive through McDonald's instead of making our own meals. So it's really about making the choice to make the change. Yeah. So we want to improve our overall health. How do we do it? We eliminate or reduce the super processed foods. We want to concentrate on those whole foods, lean proteins, complex carbohydrates over simple carbohydrates. We want to increase our fiber intake and water. Water is a big one. Nobody gets enough water, especially being from Arizona where it's so hot.
Yes. Even in March.
Right. I tell all my patients, your goal a day should be 100 ounces, unless we have some underlying disease where we can't drink that much, 100 ounces.
Yeah. I heard some very simple advice about eating better and shopping better, which is to shop around the outside of the grocery store, where you'll find fruits and vegetables, where you'll find grains, fish and poultry if you eat meat, but those things as opposed to the dead center where you find all the sugary cereals, all that ultra processed crap, right?
Yep.
So there's that, but then there's also the issue of the reality of where we live. There are people, Mojave County is huge. There are people who are living in what are known as food deserts.
Yep.
Then it becomes that much more difficult to get quality food.
It is. It's hard. My advice to them when they're having trouble affording the food or don't have a grocery store within walking distance of their house is it doesn't have to be fresh foods. It doesn't have to be fresh vegetables or fresh fruit or fresh chicken. Frozen foods have the same exact nutrition. Canned foods is another good option. And my patients that have blood pressure issues and are watching their sodium, I just tell them get the can and rinse it.
Okay.
So there are options when we're not right next door to a grocery store and can't, get that way. And then when it's fixed income issues or things like that, it's easier than it sounds if you have the right recipes and the right stuff like that. So I have a lot of printouts that I give my patients with good, easy to afford recipes. I always go to dry beans. One of the cheapest things you can get, a big old bag of dry beans, and it's one of the greatest things for you. Great in fiber and just very nutritious, dense foods. And then you add to that. So you're getting a nice, fulfilling meal with limited stuff. Shopping deals, look at the ads, shop the deals. Store brands are okay. We don't have to buy the name brand things. And then I do this in my own life is I make my menu weekly. Off of my menu, I make my shopping list, and then you just stick to it. Avoid your impulse buys. You don't need those cookies or candy near checkout.
The easiest way to avoid cookies is to not buy cookies.
Correct.
I can say that on good authority. Well, another key to all of this is having a good relationship with your primary care provider.
Absolutely. You have to jive. You have to be willing to bring up your concerns and issues, and your provider has to be willing to do all the screening stuff with you. So your prevention and health, yes, has a big to do with you and your primary care doctor.
When things are going well, when we feel healthy, we're less likely to go in and be seen. For patients who are feeling well, how often do you want to see them?
Annually is all I ask normally. So if we don't have a lot that we're following, I want to see you once a year. Want to get some blood work on you. And then if you're in those ages that we need some advanced screening, like their breast cancers and their colon cancers, we'll talk about that. But for my young adults that aren't quite there yet, once a year, at least let me get some blood work on you and make sure everything's working okay.
Well, Erin, you've been a nurse for a long time, and I understand you are also involved in training other nurses, true?
Yes.
If you were meeting a new gung-ho nurse just showing up for his or her first shift, what kind of advice might you offer?
Be open. So what you learned in school, the textbook way, may not always be the best way. Always be willing to ask questions. There's never, ever a bad question. When we get nurses that think they know everything, that's when we have a problem. So always be willing to ask questions, and always, always, always listen to your patient. That's their body. They know their body better than you ever will, no matter how long you've treated or known them.
What is ahead for you and your practice here at Mountain Shadow?
I'm just really excited to be back at KRMC. I don't plan on going anywhere anytime soon, and I'm just looking to build up my patient panel. So if you're looking for a primary care doctor or provider and sound like I am the one, please come and see me.
That is Erin Black. She is a family nurse practitioner here at Mountain Shadow Family Medicine. And if you'd like to make an appointment with her, you can call 928-681-8530. That's 681-8530. Erin, thank you so much for your time today.
Thank you so much for having me.
And that is the program. That's another edition of Focus on Your Health. I'm TG LaFredo, and thank you for listening. We'll catch you next time.